Above and beyond the government's plan to build modular hospitals and more isolation facilities for COVID patients with the Isolation Czar himself, Public Works Secretary Mark Villar. Mark, great to have you with us on Newsnight. So tell us, when can mild and asymptomatic patients be transferred to this standalone modular hospital? Can it be as soon as today?
I think, well, the DOH is in a better position, but when we were there earlier, nandun na yung mga doktor. So maybe in the next day or so, siguro may i-prepare lang nila yung area. Pero nakahanda na. Actually, yung facility is not only for mild patients. It's for it's also an ICU facility. So it's for severe, medium to severe. Hindi siya pang mild, pang medium to severe cases. So it has special features that allow it to service ICU patients. It has oxygen supply. It has various equipments that are designed specifically for COVID. So iba talaga yung mga features ng modular hospital.
So Secretary Villar, before we went to air, one of your former colleagues at the Senate, Nancy Binay, had a comment about the opening of this new COVID facility, and she said, pakiusap, just open the facility. Sayang ang oras sa ribbon cutting, speeches, and photo ops. These things are unnecessary and leaves a bad taste for families of COVID patients who are racing against life and time. So the big question now is, after you built this modular hospital, how many more, Secretary, will be built? Because we're hearing a lot of horror stories, nightmare stories of our friends and relatives who are waiting outside hospitals and in tents because they can't get the right treatment for their COVID cases.
Well, earlier, what we had is I met with the whole team actually earlier. We wanted to discuss strategies to respond. So nandun kami kanina. Now, of course, they were pressed to cover it, but that wasn't the purpose. Ang purpose naman namin kanina is pag-usapan na. Kumpleto kami kanina. At hindi lang yan yung strategy namin para mabawasan yung mga capacity issues. We're also working with the private hospitals to see if they can open up more wards. And this hospital is a very it's a large step, but hindi pa kami tapos. Meron pa kaming expansion. We're targeting for next month, right. Additional 88 in QI, and then additional 88 in the lung center. So minimum 176, but we're also coordinating with other areas to put up these very quickly. It takes us 45 days. So we'll very quickly ramp up our capacity for COVID.
So the timeline to build...
Ito nung November.
So the last... Yes. So the timeline, Secretary, to build these modular hospitals is 45 days. Are we going to have another stand-alone modular hospital? Is it now being built in the process?
Yes, well, actually, we're in the planning. We're already advanced planning stages for this, and we're getting ready to be built. Right after this one, we'll immediately start on the other the extension, and then we're also working on a facility NKTI for our dialysis patients. It's also an additional capacity for that NKTI, and we also have done. Modular hospitals both in Lung Center and in Jose Rodriguez. So meron na po at madadagdagan. Okay. Definitely, we will continue to produce more. This new variants of COVID virus are very strong, and they attacked us very quickly. But we will respond very quickly, and we will respond very aggressively.
And Secretary, the last time we spoke here on CNN Philippines, that was in mid-March. You mentioned that the government will have this month 700 isolation facilities with 26,000 beds. With the surging cases, where are we right now in terms of numbers?
Well, we're practically there. We're already at almost 24,000 beds. So by next month, we will exceed 26,000. So we will aggressively ramp up. Naka-monitor naman kami sa occupancy rate. Actually, it's been in the last few weeks that it really spiked here in NCR. Nationwide, our occupancy rates are averaging at 15%. But dito talaga kailangan tutukan ng NCR dahil umabot po ng 75% very quickly. So we will very quickly build additional facilities to service ang mga COVID patients. And rest assured, in the next we'll see at least 200 additional next month, additional ICU units and at least 3,000 to 4,000 additional bed capacity for our quarantine centers.
We spoke last night with Philippine Red Cross Chairman Senator Richard Gordon, and he said that they will be setting up isolation wards together with Metro Manila mayors. Secretary, is this still necessary with the number of facilities and beds that the government has produced?
Well, kami naman, we believe that we should hope for the best but prepare for the worst. So, I believe the Red Cross is doing this also with the LGUs. So, of course, we encourage the LGUs to do everything they can to increase capacity. We really hope that it won't get any worse, but nevertheless, I think we should be prepared for any possible scenario because this new variants of the COVID are very unpredictable.
And briefly, Secretary, how much has already been spent for these makeshift hospitals and isolation facilities? Because some of your former Senate colleagues want a public report on the 9 billion pesos allocated for these facilities.
Well, sa amin, I'm not sure. I think there was, in the Bayanihan, there was funds allocated, but a lot of it was used for yung payment for hotels and other quarantine facilities. Sa amin naman, we've spent about 5 billion, almost 5 billion for the almost 26,000 facilities that we've put up.
Thank you so much for joining us, and keep churning, please, Secretary, these isolation facilities and modular hospitals, because our kababayans who are saddled with so many problems, especially this COVID-19 problem, need them. Thank you so much for joining us, Public Works Secretary Mark Villar.